Thanks, Sue Ellen.
Hi, good afternoon, everybody. This is Sue Ellen. I want to welcome you to our long-term care committee meeting. We've got a couple of things on the agenda and a couple of announcements that we'd like to make, to get us started and get us kicked off. We've been trying to have a yearly event. A couple people are upside down. We've been trying to have a yearly event where we recognize all of the home health aides that are providing care to our patients in the community once a year. We haven't had it for a couple of years, but we're going to have one this year. And it's going to be in the fall. I can't remember the exact date. Oh, it's going to be November 13th at the Fountain of Light between 4 and 6. But we're in the process of doing the planning for the event. And, we need help on the committee to plan it. And there's going to be a meeting, a planning meeting on August 6th at 9 o'clock. And if you're interested in being on the planning committee, Karen, should they reach out to you and let you know? Yeah, just let
Yes.
Karen, let Karen know. And we could really use, some help with planning the event. I think in previous years, we've had up to 75 or more people come. So we would like to have, as many people, that we can, attend the event to tell them thank you for everything that you're doing. And we also try to include a some kind of a learning session during the event because the home health aides need, I think it's 12 hours of in-service a year to keep their certificate. And so we try to provide an in-service to give them credit for that when they come. So we can kind of do two things at once. So I wanted to let you know about that. And then also we have another event. It's an upcoming talk called Tough Stuff. And it's September 5th at noon. And I believe Karen sent out a flyer with the announcement for the meeting. And that is going to be on September 5th at noon. And in the link, there was a registration, a way to register for that training in that event. Anybody else have any announcements that you'd like to do or give?
Just so you know who I am, I'm Ben Bassett. Teresa Sivers was my predecessor in this position, New York Connect specialist at Finger Lakes Independent Center. So just in case you're wondering where I came from, the link to this meeting was forwarded to me. So glad to be here. All right.
Great. Welcome.
Yeah, thank you.
And Karen put a reminder in the chat. Please put your name in the chat so that we can include you in the minutes that you attended the meeting. Okay. Anybody else have any announcements?
Yeah, I'd like to go. Oh, go ahead. Okay. So I'm Kim Owen. I'm from Longview, our Director of Marketing and Sales. And I just want to throw out a few things. We finally have started our renovation project here at Longview, and it officially kicks off on Monday, but we've started making the updates already. But we're going to have contractors here pretty much for the duration of the year, renovating our independent living apartments and common spaces and replacing the carpet. We've already replaced the carpet and the enhanced level and replaced all of our kitchen appliances. So we're kind of excited about that. And we'll be bringing in, we'll have some information sessions on the 14th and 21st that are almost already full, just to start talking to folks about, future residents who are interested in putting a reservation down on an apartment once it's renovated. We're also going to be having an open house on September 11th. That's gone out in our newsletter. And again, it's another event that you do need to register for, but we're going to be doing some updates to the patio homes too. So we're going to be able to start walking some folks through there. So we're very excited about that. So I'm hoping in the next few months I can start inviting some people to come on over here from our provider groups to see what we're doing or just talk about it. I'm happy to come to people's offices as well. And I've started doing some of that. Also, this is our 25th anniversary of our Ithaca College Longview partnership. So we have a celebration that we're planning in October with the hopes that some of these apartments will be complete by then, which we think they will be. So we'll be putting that information out into the world. It's also the 50th anniversary of Longview in the community. And then I also want to let people know that we are doing a monthly wellness series that we've been doing for the duration of this year and going into next year. We already have it scheduled out, and anyone's welcome to that. Providers are welcome. Our residents attend it, as well as community members who may be like prospects or future residents as well. So they're the first Friday of the month. So in fact, I might have to jump off early because the next one is today, but they're on pretty interesting topics, not directly necessarily like health related, but they've been pretty interesting. We've had a pretty good turnout for them. So, you know, I send those out in our newsletter, and then just constant contact, email blasts go out. And then the last thing I want to mention is that we are still promoting our moderate income program for our assisted living. Our standard assisted living. We also have enhanced, but this is just specifically for the standard. So the rate for assisted living is $4,500 approximately a month, but we can go as low as $2,500 if the person meets the financial criteria. So it's above the Medicaid rate, but it's for someone who's kind of in that in-between spot. So if you have any people that you're working with, definitely send them our way and be happy to talk to them about that. And that's it. Thank you.
Thank you, Kim. Thank you. Did somebody else was, yes, Sarah.
Yeah, I have one. I'm Sarah. I'm an outreach counselor with the New York Statewide Senior Action Council. We have a free teach-in coming up August 27th of this month at 10 a.m. And it's going to be on emergency medical services in New York State. The speaker will be Dr. Brenda Morrissey, Secretary of the New York State Volunteer Ambulance and Rescue Association. It's free to attend. It's over Zoom or by phone. So if you have anybody who's interested in attending that you work with that's not comfortable with Zoom, they can call in as well. And you can register for that right on our website. And the website's right in the chat. But I'll put it in there, link it again as well. But we do teach-ins usually once a month. So if you have anybody, any topics you're interested in, maybe coming and speaking about that you think are important, let me know. If you'd like to come and do a talk for statewide. We just have community members that come and tell us about things they're interested in hearing about. And that's how we generate the teach-in topics, or community members like yourselves who think there's an important topic I want to get out. So we host teach-ins for things like that as well. And this was one people expressed interest in. So we found an expert to come talk about it. So we do these free teach-ins, and we do have our convention this year in Saratoga Springs is going to be, this year we're doing it a little bit later. Let me just pull up the information. Convention this year is going to be in October. So it's going to be October 21st through the 23rd in Saratoga Springs. And we do that every single year. We host a variety of people from across New York State to come and speak at convention. We talk about a lot of topics. And there's going to be interactive forums. Elected officials will come and speak. A lot of different cool and interesting things are happening for that. If you'd like more information, let me know.
You certainly picked a nice time of year in Saratoga.
Yeah.
Yeah.
It's just the open enrollment. So I'm like, all the counselors were like, oh no, because we usually do it a little earlier, but it'll be fine.
Yeah. Oh,
It'll be nice.
That sounds nice. Thank you very much. Thank you. You have a
You're
lot going
welcome.
on. Angela, do you have
Just
an
very
announcement?
quickly, it's a question. The November 13th, the home health aid event, you say it Fountains of Light. I think you might mean Foundation of Light.
Yeah, that was a typo.
Okay, just
Sorry about that. Thank you for catching
no
it.
problem. No problem.
I think it might have been autocorrect.
Okay, and I didn't pick up on it either. Okay, any other announcements? I have one that's pretty exciting. We have a grant from Mother Cabrini, and we're going to be launching a program where we can have an EMT go into a patient's home with a virtual care appointment with their primary care physician to try to prevent them from having to go to the ED or the hospital. And we're just ready to launch that here in the next couple of weeks. So that's kind of exciting for our patients. Anything where we can keep them at home, and prevent that trauma of transport, that's what our goal is. So we're just ready to launch that and really excited about it. Anyway, any more announcements? Karen, do we want to move to the next topic?
Yeah, I think that would, unless you want me to, yeah, why don't we have the presentation and then we can do the work group updates after.
Okay. All right. So the presentation is going to be by Kaitlin Hascup and Terry McCann. Are they on? Can we
Yes.
turn it over to them?
Yeah,
There you
we're
are.
here. Hi,
Okay.
I'm Kaitlin. Hi.
Hi, I'm Terry.
Do you have a presentation?
No, yes, we do.
Oh, okay.
So
That's all right. I
We
just
do.
didn't want to miss
yeah,
it.
I'm
Yeah.
one of the nurses in long-term care at the Tompkins County Department of Social Services in the Medicaid long-term care department.
And I am part of the ISEP program, which is administered through Office for the Aging. But I am located at DSS in the cubicle right next to Kaitlin.
Yeah. So I'll start with our Medicaid long-term care program. So just the quick background, we provide assessments for in-home aid services, and we serve our requirements for eligibility are the clients that I work with, screening eligibility, they need to have Medicaid, not Medicare. Sometimes people call and there's some confusion about that. And then our program, there's no age requirement. It's beginning of life to the seniors. So children through seniors can be eligible for our program. The aid services that we currently are assessing and authorizing are for like light housekeeping, errands, meal prep. If people need personal care now in our county, they need to go towards a managed long-term care. And there's a new intake process regardless of what level of care you need. It's fairly new. The New York Independent Assessor, everyone needs to go through their initial assessment and intake through the New York Independent Assessor. And then if they only need housekeeping and we can meet their needs, they can come to our program and we can authorize services. If they need personal care, then they would pick a managed care company for their long-term care. So there's more steps to it than there used to be. It can be a little confusing for community members and providers and it's just a new system. And we also provide like options counseling for callers in the community, referrals, resources, just even if they're not our client, we can be a resource for seniors and care at home services. And we, referrals for the emergency buttons through the Office of the Aging or FoodNet. My clients in long-term care, they can utilize the Medicaid transportation, whether that's a cab or through Gadabout. We also do the PRIs, which are the instruments that people need for nursing home admissions. So if someone in the community is applying for a skilled nursing facility, we can do the PRI for them at no cost, even if they're not our client. Again, that's for nursing home admission process. So if someone's applying we'll go and we'll do a home visit and help get that done. So yeah, we do home visits for our assessments, and I don't know what else to say about it today.
That's really great to know about the PRI screening. I
Mhm.
didn't realize that, and that happens a lot, with our patients, and we didn't
Mm-hmm.
realize that we could, ask you to do that. That's really great information. Thank you.
Yeah, sure.
Oh,
I was gonna say, would it be better for us to wait for Terry to then do her presentation and then we can open it up for like questions? Does that make
Yeah.
sense?
I think so, 'cause there's a lot of
Okay.
overlap, but there are some differences.
Okay, sounds
Yeah.
good.
Okay.
okay. So, yeah, can everyone hear me?
Mhm.
Okay.
Yes.
Awesome. Okay. So, yeah, so our program is similar. I mean, the two of us work in long-term care programs. And so that just means that people need an aide to come to their homes to help them. And the point is, we want people to live in their homes, remain there for as long as possible. So our goal is to prevent nursing home admission, until it's absolutely necessary. So, so my program is called ISEP, and that stands for Expanded In-Home Services for Elderly Persons. And the requirements for my program are different from Medicaid. So for one thing, we operate through Office for the Aging, so you have to be at least 60 years old to be in our program. You also cannot be on Medicaid. So our target audience are clients who are low income, but they're not low enough to qualify for Medicaid. And what we do is we always ask people what their monthly income is. And if it's under or doesn't exceed $1,883 per month, then they can be eligible for our program. So so we don't actually have aides, but we don't have the aides, neither does Kaitlin's program. We have contracts. Our ISEP has contracts with some of the local home health agencies. And so when we get a new client and we want to find an aide for them, we have to look to our contracted agencies. So if they don't have an aide, then the person is on our waiting list. But even though they're waiting for that aide, we can still help to link them up with other services, such as shopping for food, medical, transporting people to medical appointments, arranging transportation. We try to help in other ways too. We are grant funded through New York State. So typically Medicare does not cover aid service. Medicaid does. So since Medicare doesn't, New York State came up with this grant funded program to help, provide aid service to people who want to stay out of nursing homes. So we also have access to other funding, like if someone needs an assistive device, like a lift chair or walker, and they're in our program, we do have discretionary funding that we can use to purchase those things for our clients. Yeah, in order to get on our wait list or even Medicaid, people will call our office, call the main line, and whoever takes the call can take a written referral. You know, we determine if it's Medicaid or ISEP, and then well, for the ISEP program, you know, after I talk to the client a little and, you know, confirm their eligibility, then I schedule a home visit with them. And that visit is to do paperwork to get them enrolled, and we fill out lots of paperwork. And that initial visit is like 90 minutes to 2 hours. So, yeah, and then we go back to the office and put all the information and call our agencies. We also have the option of using the Finger Lakes Independence Center. There are aides who can work through them. They're not an agency, but like it's a way for people to get paid, people who aren't aides with a private agency. They can register as aides with the Finger Lakes Independence Center, and our clients can hire off that list, or they also have the option of having a loved one, neighbor, friend become a home health aide. They would have to register with Flick. So, and that's, there is a severe shortage of home health aides in New York State. Probably others, for sure, other states too. So, a lot of our clients do end up using that, you know, using Flick to have a family member get paid to take care of them. The other thing I need to point out is that the hours, like if someone says, you know, my mom needs someone to be with her all the time, we have to say, you know, we can't really do that. Our program is just very supplemental. We can authorize people a few hours a week, like under 10 hours per week. Sometimes it's 2 hours a week. And sometimes, you know, that's all a person needs, someone to come and do their laundry. So, yeah, but it's, you know, it definitely is limited in, you know, in terms of how, you know, how much aid service is available. So, you know, we try to spread the money around as much as we can, but we seem to always have a waiting list of people, you know, who wait for aids. But like I said, in the meantime, we try to assist them by linking them up with other services or providing other services for them. So that's what I have. Yeah, I'm sure you have a lot of questions.
I'll let people go ahead and maybe throw the questions in the chat as we go, and we can read them out to you. But you know, I'm trying to write all this down, and then I just wonder, there's so much good information and so many different services that you mentioned. Is there a place to go back and reference that, or to like sort through it? I know I'm more of a visual, sometimes I've had to see it than hear it, but also wondering, where do community members or care managers or stuff is go to find that info?
Well, Office, I see Karen raising her hand. Office for the Aging, every year publishes these, booklets that are full of information for, services within Tompkins County, including aid services and the ISEP program and, other types of things.
I
And I
can't hear
think,
you.
and I think online too, right? Can you hear me?
Mm-hmm.
Yeah, on the website, right? Either.
Well, I may have not looked real close, but on the one that I was on, it wasn't comprehensive, but I might have been looking in the wrong place. So unfortunately I can't hear Karen Bullis at all.
Yep.
And if there is like a PDF or a link, would it be possible?
Well, I
to
think
send-
Karen, if
If-
I could interrupt you, I think what Carolyn's trying to tell us is that you don't do those those booklets anymore. Is that correct, Carolyn? No, they don't do the booklets anymore. Yeah, they used to do
That's
those,
news
but
to me.
they
We
stopped.
do.
We do.
We
Hey,
do. Oh, look.
uh, this
we-
is Dawn, at Office for the Aging. Can you hear me?
Yep.
Yes.
Okay, I don't know why you can't hear Karen. We do have resource booklets that get updated every year.
Oh, okay.
We have hard copies and we also have them on our website. You can go to the main page and scroll down to the bottom and the booklet cover, you can just click on it and it will open up. So there's a lot of in the blue covered one, long-term care services in Tompkins County. It starts out with all in-home services and goes over long-term care and the ISEP program. So that in contact, so that information is available there. So, no, we can't hear you, Karen. No.
Now?
Yes, now
Oh,
we
yes, actually.
Yay. For Karen.
Heart attack. I was like, no, Sue Ellen, we still do those booklets.
Okay.
Sorry. And I didn't mean to interrupt you, Dawn. Thank you for for jumping in. So yeah, we still do those booklets every year. We have information about ISEP because it is a program of the Office for the Aging, but we also include all of the information about the Medicaid home care program as well. Those booklets are on our website. They're available in hard copy. So the information is out there. I just wanted to kind of like add a little bit about, the ISEP program is it's really like a case management program as well. So while Terry and Joanne, we have 2 case managers who do it. So while Terry and Joanne do the initial need is that personal care aid service, it's a non-medical program. But they also provide that holistic kind of, do they need food? Do they need any sort of equipment, as Terry mentioned? So just because somebody may not be receiving the aid service right away because they're on our wait list, that does not mean that the case management piece goes away. There are requirements that they have to check in. They do 2-month phone call check-ins. They have to do reassessments every 6 months. So it is kind of, we really do follow the client. The other piece I just wanted to add was Terry mentioned our wait list, and we do have a wait list, and I'm not sure if everybody is aware, but I don't know, 2 years ago now, a year and a half ago, I can't remember. When Holly came on, the Office for the Aging, we have hired our own part-time home health aide. And her role here is, she's 20 hours a week, and her role specifically is to meet the needs of those folks who are sitting on our wait list. So Terry and Joanne and Holly kind of huddle every week and determine, who is sitting on our wait list waiting for an agency aid service or the consumer directed program through FLIC, as Terry mentioned. And Holly, our HHA, can go and do visits and provide the personal care that they need while they're waiting. So I just wanted to add that little tidbit. Sorry that my mic didn't work.
Yeah, no, thank you. Yeah. I'm sorry. I didn't mention Holly. And I saw there's a question from Ben asking, about the income cap. So yeah, so you're right. ISEP is a sliding scale. So I didn't mention that. So what happens is, so let's say a person calls and they say their income is $2,000 a month. So that's, that's pretty close to 1883. So the first thing we do is we see if we can lower that figure. And what we do is we gather information about some of their household expenses. And if those expenses add up to a certain amount, then we can deduct money that is over that amount. And if they still, let's say we can't mitigate that number, the $2,000, let's say, that doesn't mean a person can't have an aid. That just means that, we would have to determine how much they would have to contribute toward the aid service. So let's say they're, and we call that a cost share. So if their cost share is, let's say 10%, and, the agency charges $36 per hour for an aid, then our client is liable for $3.60. So yeah, so we do have people who, they have to contribute some of their own money, but it's way cheaper than hiring an aide on their own. So yeah, so that's why we call it a sliding scale, because we have clients who pay $0 for aid service, and then we have other clients who, do pay like, maybe 40% of the cost share. So yeah, so that 1883, it's a guideline, but it doesn't necessarily preclude anyone from coming into our program.
I was wondering, Kaitlin, you mentioned briefly about that there's a new type of application. Can you talk a little bit about the application process for folks and
Sure. Yeah.
some strategies?
Sure. Yeah, I'm not sure how new it is now. Lost a little track of time. But when someone calls in, again, as Terry said, we'll screen them to see which direction, like should they go to the ISEP to get more information, or the Medicaid long-term care, our program. So if they're appropriate and they meet the requirements for and to be assessed for aid services through Medicaid, we used to do the initial referral and intake and assessment and get the orders from their primary doctor. But now that we're a managed care county, the New York Independent Assessor phone number is actually the first place that they need to go, and we provide that information. And then when they go through the New York Independent Assessor, instead of us assessing them, the initial assessment would be by the Maximus nurse and the Maximus provider. They do it remotely, or they're getting better at doing it in person, because initially a lot of our clients don't have internet access or smartphones or computers, or it's challenging to navigate them. So that was putting off the initial process, preventing it from being done timely. But that has gotten better, and they can also offer in person, but the primary way is through the telehealth, through the internet. So once they schedule, they have to have 2 appointments. One is with the nurse for the assessment, and one is with their provider through the Maximus and the New York Independent Assessor provider. And then once they have those appointments done, then they either they'll get accepted or approved for managed long-term care, or they get denied. If they get approved, they have to go another step. It's like now a multi-step process, where it used to be we were just kind of the one-stop shopping. So if they get approved for managed long-term care, then they need to pick their managed care company through the New York Medicaid choice. They have to call. They should get a notice of decision in the mail, but sometimes that can take a long time and it doesn't show up, or it can be confusing. So once they get that notice of decision saying whether they're approved for managed care, well, either the next step is to pick the managed care company, or if they're denied, then they're supposed to call us for our long-term care. If they're approved for managed long-term care, once they pick their company, which would be in this county, the last I knew it was like Fidelis, Nescentia, iCircle, the contracts. I'm not sure what the current contracts all are, but that's the most recent. Then they pick one of those companies, and then their case manager contacts them and does the care plan and the authorization and their own assessment. If they come to us, then we would schedule a home visit and do an assessment and a care plan and an authorization based on need. Our program is we have a cap of 8 hours a week now, the most we can authorize. And it's housekeeping or errands or meal prep. If anyone needs personal care, like hands-on care, then they're not appropriate for our program. We can't meet their needs. So that would be more of a managed care. And managed care doesn't have the same cap in hours that we do. So our program's very supplemental. It's just a little bit of help to help support people in their homes. And as Terry said, we don't provide the actual aid, and we don't have, like Karen Bullis was mentioning, we don't have a Holly, or we don't have our own aid for unmet needs. So our clients we don't have a backup. They'll have to wait. We only contract with caregivers and the Finger Lakes Independent Center. So right now people are having more success with using the Finger Lakes Independent Center, I would say, the consumer directed program. And I don't know, any other questions about it? Because that's kind of a lot.
I'll just ask my question. I
Sure.
typed it in there, but I recently went through the assessment process with someone, and
Yeah.
they were approved, but they have WellCare, and not one of the managed care providers on the list. Would that person need to change to a new managed care provider?
For long-term care, they would need to pick
WellCare is their Medicare insurance.
yeah, so they would need a Medicaid
Oh, it is.
managed.
My bad, my
Yeah.
bad.
Yeah,
All right,
it's
I'm
okay.
sorry. Yeah, of
no,
course.
and that, thank you. Yeah, that happens. We're all sorting through
Yeah,
it. And the
so
Medicare, yeah. So
she probably already has one of these, but I'll find out. Yeah.
yeah, so the Medicaid managed long-term care companies, again, that would be like the Nescentia, the Fidelis, iCircle.
All right. In hindsight, that was kind of a stupid question since
No,
it had care in the
it's-
title. But
no, it's
yeah.
not stupid. Yeah. And there are, when you call Medicaid New York Choice, those options should be clarified,
Okay.
but it's quite a few steps for people to go through, especially if they don't have an advocate or a caregiver or, and we will, we encourage people to call us so we can kind of coach them through or check in to see where they are at the process and, do what we can to help facilitate Yeah.
And I'll just point out from a kind of an
Thanks.
advocacy point of view. Yeah, no,
Thanks, Karen.
this was, thank you guys. It's a lot of information and it's complicated and I feel like it's ever changing, right?
Yeah.
And you know, one of the issues that we were looking at was they had raised the Medicaid limits, right?
So close now. Yeah.
Right. So what was starting to happen was, you know, some of perhaps of our clients that were either qualified for ISEP had established aides with them and all this stuff are now qualified for Medicaid. And, you know, how do we in good conscience take that away from them and make them go through this, in my opinion, craziness just to get an assessment done by an independent assessor, you know, to see how many aides or hours that they might get through a Medicaid provider. So it's been kind of we've been kind of keeping an eye on it as far as our, you know, clients not falling through the cracks. That's kind of our biggest concern, that people aren't just kind of left out in the loop, you know, who again may now all of a sudden qualify for Medicaid. I don't know if I said that clearly, but that's just something that we're kind of keeping an eye on. We've already
Yeah.
had some clients, Terry, you probably know more than I do, that have already kind of transitioned, you know, into the
Yeah.
Medicaid home care program. So,
Yeah,
Oh,
I have. Yeah, some
Mhm.
people have, and I have a few more who are
Mhm.
in process. And yeah, I mean, it turns into, you know, like
oops.
a real life thing. You know, I have a client right now. She just got approved for a managed long-term care company, and unfortunately, the agency she has right now, they don't have a contract with any of the managed long-term care companies. So I'll probably just, you know, hold on to her for a little while, and then hand her over to Kaitlin. And, you know, she might be without an aide for a while. And you do kind of feel like you're pulling the rug out from under some
Yeah.
people. So yeah, a home, the issue of home health aides is enormous. It's an enormous problem, and
Mhm.
it's just getting worse as, you know, people age, and yeah, it's very challenging. So we try to do what we can to help people, but
Yeah.
we are limited.
And we just encourage people to call us back along the way. Once, because we don't take the referral at that time for Medicaid long-term care, but if we have their contact information and we know they're going through the process, we can kind of help keep track. And if they call us back and say, look, we had our assessments done, but we haven't heard anything, then we can look it up with their permission and we can just, you know, again, kind of coach them along the way. And I see that Kay from Catherine from Stick says she can help facilitate that, or the navigators through the Human Service Coalition, you know, try to support people through the process, and just try to keep them on our radar. So again, it's just, you know, call us when in doubt for any questions. See if we can muck through it together.
Can
Yeah.
I say something?
Yeah.
Can you hear me?
Yep.
I just stopped by Tompkins County Office of the Aging yesterday. So I was just looking for an appointment to come and introduce myself there. Yeah, we processed the Medicaid for New York State of Health. My office is right at the Tompkins Community Action Center. Does anybody want my phone number right now, or?
If you want to put it in the chat, we'll make sure we get it in the minutes.
Okay, awesome. I'll put it in the chat. So yeah, anytime, or I can meet people at location, at either your offices, or I can go to their home or at a business. So very accommodating. Yeah, and I'm a navigator as well. Here we go.
Is that like, so Are there more than you? Are you the?
I'm the one
low-
covering Tompkins County. Yeah.
Okay.
We also have a
And-
Human Service Coalition as well, which you can
Right.
call 2-on-1.
Hi.
And so as part of your outreach and stuff, it sounds like you were going and kind of introducing yourself. Are you also like getting out to like the different other organizations that might be coming in contact with people who might need you? I'm just wondering, I guess, after the hard part, I think, in that what I really want to see for this group is how do we problem solve or look at we've got great services, but not everybody knows how to access it, or it's really a challenge to get through some of the hoops. So where I'm going with or thinking off the top of my head is just like, how do we make sure everybody knows how to get connected with either 211 or Catherine?
Human Coalition also has me on their 211 server. So
Okay.
if people call, they have a choice to either call them or call me, whoever's available first.
And 2-on-1 also, you can do a web search as well. And so you can go to their website and do a web search and find that information as well.
I haven't gotten over to meet you, Nicole.
No.
I'd love to
No.
meet you guys and come
Yes.
by and say hello.
We would love that. Come on over.
Great. Is there anything else that like pops up as we're talking about? We heard the services that Terry and Kaitlin have. We've got some navigators that can help people along with that. Are there any like scenarios or things that come up that you'd like to? This is a great time to throw out some questions. We've got people here because what I always find is we talk about it and then you get a real person in front of you, and then sometimes there's a couple of different they have different aspects or whatever, and so you don't know that you should go to somewhere else or go here. And I'm just wondering if anybody has any questions or thoughts or even recommendations.
I would just encourage people to, call us for any kind of question or resources. If we're not we'll try to just connect them with other services, or, I use 211 sometimes, or, so anytime a community member calls, we really try to, get the details of their individual circumstances and situation, and then see, if we can meet their needs. If we can't, then, who to connect them with. And 211 is a great resource. And it's great to work with Human Service Coalition and STIC, and I don't know.
We also help connect community resources as well as statewide. We help with patient rights, Medicare fraud, Medicare counseling, but if it's a service that they're looking for that we don't do, we'll help connect them to an agency that does offer that service. And we cover the whole state. So if you do have anybody that's in your area that maybe is outside of your service area that's calling or is looking for something that maybe you're not familiar with the area that they're looking for, you can always refer them to us too, because we're free. And we cover everywhere in the state. So just
Okay.
I'll let you know for that too.
And as you were speaking, I was for managed long-term care, the advocacy group that I haven't, I've given out the number, and I've tried the ICANN, the independent consumer. I don't know, they're supposed to be the primary advocacy, client advocacy group for people who are having challenges navigating the managed long-term care, getting their needs met. But again, I don't have direct experience with that. So that's an important resource.
I can definitely help people get connected to ICANN if you need it.
Yeah. And we'll give out the information if people call. They'll call us about their managed long-term care, and we'll listen, and we'll try to be supportive and connect them with resources that can actually help, because that's not something we have any, overlap with.
Yeah, and we have all of that information in our resource guides too. So I think I don't think it's an issue of the information not being out there or available. I think it's in so many different places that sometimes it's, it kind of is situational for the person, depending on either who they're working with or what needs they're currently looking for, as to maybe who they reach out to. Like there's 211, which is a huge resource. We have the New York Connects resource directory that I put on, I don't know how many months ago now. So there's that people can use. There's statewide, there's our office, there's, a lot of folks that people can reach out to. I think and that was kind of the intention of our resource guides, is we have all of you in our resource guides, so everybody is in there. But yeah, it can still be kind of frustrating to help people access all of that.
Well, I think too, if we think about all of the programs that we do have, but then all of the criteria that each one has in order to meet the funding thing, it's not only confusing to us who are here and we do it, but it is extremely confusing to those who don't use it on a regular basis. And I will just say, having a family member who has been in and out of a hospital and rehab since June 3rd, if it hadn't been for her being connected with Terry, I might be, I'm just absolutely horrified, to be honest, and some of the things that have happened in the last 2 months. And I say, I just see that we have to, how do we get those people connected to all those resources and know that they're there? Because there's also a big turnover going on. And so, a lot of times, like, knowledge walks out of a door and the next person coming in isn't aware of it. Like, the trying to set up somebody to go to the infusion clinic on a Saturday on Gadabout isn't going to work. But that person who is trying to pull all these levers to make a complicated situation work, I'm just trying to, yes, you're right, the resources, totally, that's guide is what that's meant for. And if we can then step back in this group as we go through and figure out, like, how do we continue to get people educated on it? Do you know what I mean? Because a lot of times people will say, oh, I didn't even know that existed. Do you know what I mean? And yet we've had it and the resource guides were there. How do we get people more informed and how to get through it? And is there anything that we, as the people who are committed to this, can look at our processes or systems and say, can we uncomplicate that? Do you know what I mean? Like, so sounds like we're started on that, like having Kay be able to help, or 211 help somebody navigate through, but not everybody understands that that's there for them. So how do we get that connected? And I say that in a positive way, not as like a downer, but like just saying, like, I'm excited to think that we could possibly make differences in this. And I know that everybody around the table or around the Zoom is really a dedicated person, because you're here. So that's really quite inspiring, actually. So I don't mean to sound down. I'm just exhausted and tired, but I just shout out to Terry, McCann, and your program. You make a difference. And I just wanted to say thank you from a personal aspect of that. But Sue Ellen, I wondered if you could just mention, like, since we talked about Medicaid, I know you have Faith, who is in Titus Towers, who, if somebody qualifies for Medicaid, there's extra interventions or interactions that they can do.
Yeah, that is the Medicaid Health Home Program. So Faith is working. So that's a program for people who have Medicaid, and they have 2 chronic diseases or 1 mental health disease. That's how they qualify. And they can have support from, they're called care managers. So they help them with coordinating. It's just additional support for, you know, people on Medicaid to navigate the system. They help them ensure that they go to their doctor's appointments, help them understand information that they're receiving from doctor's appointments, help them understand their medications, help them set goals, you know, and teach them how to, you know, control their chronic diseases. So what she's working in is called the Medicaid Health Home Program.
Gotcha.
Yeah.
Thanks.
And one thing I was thinking about as we're talking and how to, you know, get some of this information out, for VNS, we probably see well over 2,000 people in a year, you know, in our community if they need services. And I was thinking what I think this is what would be a good idea is to have the brochure that we're talking about that's from Office for Aging and include that in, we have a welcome packet that we give all the patients, but include that brochure, you know, for people, you know, and educate them on what's, you know, what we're talking about and what's available. At least we could get it out to that population, you know, that way. And, you know, maybe other people could, you know, mirror the same kind of a thing to get the word out, you know, to people about the resources that are available.
I think that's a great idea. Oh, okay. If we don't have any more questions, we're a little over, but I think this was all kind of really good dialogue, and I'm hoping that this will be something that we can get on a quarterly basis to have like a member spotlight. And so thank you to Terry and Kaitlin for volunteering to be the first guinea pig, so to speak, on that. And you know, we don't have the format set up yet, but we're building it. But that was one of the things that was on the survey that we saw, is that people wanted to know more about what our own members of this group do, and understand that. So our next meeting is in November. So if there is anyone here that is chomping at the bit that would like to get in front of the group, and let us know about any new programs that are coming, or just, you know, how to access services, that would be great. If you just want to reach out to me, I may also be reaching out to you to ask you to do us a favor by stepping up with that. Is it okay, Sue Ellen, if I pop over to the work group?
Sure. Yeah.
Okay, great. So the other aspect of these meetings that we're talking about in the last couple, and in the survey, is putting together some work groups that can meet monthly. In addition to this group meeting quarterly, where we'll have the updates, we have an opportunity to talk and get work groups to gather input, those type of things. So 2 work groups that have started to meet and form. One, and they're coming out of the tough stuff. We will probably still quarterly have a tough stuff speaker, but we will also monthly have work groups. And so the work groups right now, we have the Home Health Aid Recognition Planning Committee, and we're really excited about taking getting that back up and going, to be able to have the event, have an education portion, and that group is going to meet for the kind of the first time on August 6th. I would love to recruit a home health aide, at least one, if not two, to be involved in the planning committee, because I think it's really important when you're doing programming is to have your audience involved. So if anybody has a home health aide that you'd like to invite or recommend, please let me know. We can get that person. Now, if you're also thinking, I can't possibly pull off being on another committee, we are looking for our folks to be partners. So maybe you can't be the planning, but you have things you could have a space that we could utilize, or maybe you have giveaways, or you have materials, or those type of things. So don't limit yourself to just being on the work committee, so to speak. And then the other group that we're getting back together, and we're still in the midst of trying to find a better name for it. And so today I just threw on the agenda the what matters most on this, because we're looking at end-of-life issues. And one of the 4 M's, which is a part of the age-friendly health system, is what matters most. And end-of-life issues really come to light in this phase of the 4 M's. And so we have a 2-prong out of the meeting that we just had kind of came and surfaced up, is that we're going to shoot for some low-hanging fruit, and we'd like to get another community event going, similar to the talking about death won't kill you. We don't necessarily have a name yet, but we're looking at it. We have resources that have already been kind of put together, and Angela, who does the death cafes and those type of things, has been great to say. She'll be really helpful in those event type things. We're also looking to see if we can connect with Elizabeth Bergman and her end-of-life class in the spring to do a spring event there. So we're looking at the fall to do an event, and then the spring as well. And then the other prong that's coming up in this group is a desire to really want to work with our health organizations and community organizations, and making sure that they know where resources are and what's available, because we had been making some progress of identifying the palliative care and the hospice and all this stuff, and then COVID hit and we kind of went in a different direction. So we're going to swing back around to try to see if what we can do to raise awareness, especially around the age-friendly health system, which then what matters most kind of fits in that area. And I do know that on the next meeting that's coming up with the home health aid recognition is our group that met last week wants to see if there's any collaboration opportunity with the home health aid. Is there a possibility that we could do either provide the resources, some resources to go in a packet, or could we do the education portion on how to talk with your clients about death? Because as we were talking in our group, we find that our home health aides are usually the ones that are starting to engage in those conversations with them. And it might be an interesting thing to talk about, how do you have those conversations? So that's the work that we've been doing at this point. And we're still kind of forming, and so it's never too late to join. But I just wanted to open it up to if anybody had any questions about that. And of course, my dog at this point is scratching the door. I'm going to mute, but I'm
Let me, there's Karen, he wants to come to the meeting. Just a couple of things. Karen, you're welcome to use our site for meetings, our conference room. I would love to have one of our home health aides join the committee to help with planning.
fantastic. Thank you.
We also have space here. We have our conference room or our lobby, should people want to meet. That's easy enough to do.
Right, I think there's some actually an added bonus maybe to trying to have meetings at different agencies. Our work groups, do you know what I mean, as well as getting people to be able to kind of see where people are and those type of things. So thank you for all those suggestions. And then the last thing I just wanted to throw out there is I'm pretty excited about the September 5th speaker that we have coming. Jennifer Muniak is a physician, a geriatrician actually from the University of Rochester Medical Center. And she's been doing a national talk about trauma-informed care principles and person-centered care around obesity and larger people, and how that impacts both staff, providers, as well as how do you treat people with respect, and looking at that from an equity issue. And so I saw her talk in grand rounds, and it was really quite interesting. So I really highly suggest it and ask for you to promote it out. We have a flyer type thing, but she's will be doing a virtual talk on September 5th at noon, kind of thing. And so yeah, and if you have any suggestions for speakers for the quarterly tough stuff, send those along to me as well, type thing. All right. Anything before we move on? Any announcements or anything that we didn't get to?
I do have a question for this group. So this is a little bit off topic, but we are kind of exploring the idea of putting together a social group for folks who have lost spouses or partners. I know that Hospicare offers a lot of grief support groups, but I guess before we move further with the planning process, I just wanted to see if there is any exclusively social groups out there for folks who have lost someone, so that we don't, potentially duplicate programs. So does anyone know of just a social group that's out there for the community? Okay.
Are you saying around if they've lost someone, or just in general a social?
If folks have lost someone, we recently have seen kind of an influx of new members that have lost a spouse, and it seems like some feedback we've gotten is just that people are sort of hesitant to join grief support groups, and they're really just looking to connect with people more so than I don't know, take that step. So just exploring. And
it's interesting that you say that, because there's a lifelong member who she did lose her wife, partner, I'm not sure, her significant other, and she actually started a women's support, or no, it's not support, a women's social group is what they call it. Some of them think of it as a support group, but it started with only like 6 women, and there's over 32 women that are active. They come and go, and it's on Thursdays. And the neat thing is that they're splitting off, and they have their own little, like, oh, they want to do a book group, and those guys do ladies do a book group, and they've gone on trips and lunches, and they bring speakers in, and they have a topic. So it's not per se what I say that is labeled a grief, and there are definitely people in the group that are not widowers, but it is a social group that they started.
Yeah, I was gonna say you might want to check in with Liza Berger at Lifelong, because she might have thoughts or ideas, or know if there's anything particular going on for sure.
Great, yes. I'm in frequent contact with Liza, so I'll definitely reach out to her. Thank you all.
anyone else, like, I'm not gonna break us up into groups and go out and do the good, the bad, and the ugly, because we've only got 4 minutes. But if there's anything that's if really good that we'd like to end on, or something that is going well, that somebody or a little tidbit to keep us feeling the wind beneath our wings, so to speak, to keep going. Well, it's Friday.
I wish I could think of one, Karen. I'm trying. You want a thought? You want to end with a good thought for the day?
Yes.
Maybe I could come up with a thought for the day. I think this is actually from one of our home health aides, and she wants us to have this as one of the thoughts of our day. If I can find it, coming up. I think it's next. Oh, here it is. Okay. So this is from one of our home health aides, and we have a morning meeting with all of our staff, and we always have some kind of a thought for the day, to, just get people's thoughts going that are positive and, give them support. So this is one that she wants us to do next week. And the thought is, your future is created by what you do today, not tomorrow.
Can you read that again?
Yep. Your future is created by what you do today, not tomorrow. I think what that means is you don't wait for tomorrow to start doing whatever you need to do. If that's exercising, if it's, changing the way you eat, if it's your attitude, whatever, don't wait for tomorrow. Go ahead. Even if it's a small thing, just get started today. Take an extra 100 steps today, just go in the right direction. And anyway, that was her. She wants us to have that for one of our thoughts of the day for our staff next week.
That's awesome. Thank you for sharing that. I appreciate that. And we just also, I don't know if you see, Athena, there's another resource that just got put into the chat for a senior support group that's on Zoom.
Is that the Pearls of Wisdom support group? That's so funny. I just got an email with an article about the Pearls of Wisdom support group this morning. So very timely. Thank you. I'll definitely look into that.
You got an email with an article about Pearls of Wisdom? Huh.
Yes, one of our members sent it to me. I've got your email there, so I'll forward to you.
Great. Yeah, we've been going for 2.5 years. We have a core group of 6 people, but we have people come in and out. And sometimes we have people log in from other counties. We actually had somebody log in from Belgium. So that's the beauty of Zoom. It's a good group.
And I wanted to do a quick shout out to Heidi. Thank you for being an active recruiter. She's been doing a great job of sending me emails saying she's been talking to different people about joining the group. So I think that's what I'm going to end on and say, please, as you're navigating through and interacting with people, if there's someone you think that should really be involved in one of these groups, whether it's a work group or just coming quarterly, please invite them. And it'll be great to have more people involved. So thank you for today, and be looking for the minutes and the links to the different meetings. And if anybody needs stuff, you can just email me, or I'm happy to put my cell phone in if somebody needs to text me for stuff. Okay.
Thank you.
Have a great day, everyone.
Yeah.
Thank you.
Bye now. Thank you.
So long.